Okay, we're going to go ahead and get started. Welcome, everyone. I'm Sarah Kunis, and I'm the Vice President of Admissions and Business Development. Thank you for joining us for this third webinar in a series. In response to these uncharted times, we want to share what we've been experiencing in hopes that it will be helpful to you and your clients. There's a reminder that we will be muting all participants' microphones. If you have any questions throughout the course of this webinar, please feel free to use the Q&A button and we will answer them at the end. For those of you who submitted questions at registration, we will be answering them. Today's session, we're going to focus on admissions to addiction treatment in the midst of COVID-19 pandemic. Joining us today, we have Megan Schlott, who's the Director of Admissions for Pennsylvania, and Ryan Malvey, who's the Director of Admissions for our Florida campuses, Caron Renaissance and Ocean Drive. We will begin with Megan, who will give us a high-level overview of how this pandemic has impacted our admissions process in Pennsylvania, including at our call center as well as at intake. Then following that, Ryan will give us his take on how Florida is handling it in the same ways. Next, we will go through all the questions that you guys have submitted, and then lastly, we'll go to the live questions at the bottom. Depending on the volume of questions and the number of people on the call, if we can't get to your question before this is over, please know that somebody will be following up with you directly after the webinar. Please welcome Megan Schlott.
Thank you, Sarah, and thank you everyone for joining us today. The Pennsylvania admission process has certainly changed regularly over the past few weeks, sometimes day to day, sometimes hour by hour, as we're responding to the changing federal and state recommendations. Typically, our calls have always included working with families and clients around their anxiety and fear related to seeking addiction inpatient treatment. Now, on top of this, we're working with families around their anxiety of treatment during the COVID-19 time of concern. Families that we're working with, they really need clear understanding and expectation of what the process will look like, from the phone call to the door to how their loved one and their interactions will be while they're here. Families certainly want to know, how will I interact with my loved one? How will my loved one be monitored? How would their safety be the utmost of importance for your treatment center? Our admissions team is working hand in hand, working closely with our chief medical officer and our medical directors on developing the best screening tools that we can have prior to someone entering on our campus. We're working with families and potential clients, reviewing a list of questions that will be provided as information that we share with our physicians when we make the decision to bring someone on our campus. Certainly all of these questions and the evaluations that we're doing are an effort to maintain the safety of our current patients, our staff, and any incoming patients that we expect to have over the next few weeks. We're working with clients and asking them general questions about flu-like symptoms. Have you experienced a fever, a cough, any shortness of breath? Have there been any loss of sense of smell? And if any of the answers to this question is yes, how long have these symptoms been present? We're looking at questions around travel. Over the past 3 weeks, have you or your loved one been on an airplane, on a cruise ship? Have you traveled outside of the United States in the past 3 weeks, outside of your county or state of residence? We're also looking closely into those areas of concern throughout the country and asking families if they live in a densely populated area. Do they rely on public transportation to get to and from work? Or do they rely on public transportation when they're seeking out their substance or alcohol? Do they live in an apartment complex? We're also asking families and clients if they've been in close contact with anybody who has had a confirmed case of COVID-19 or is under any investigation for having COVID-19. Working with families to help identify what close contact really means. And we're defining that similarly how we do on campus. You've been in close contact within 6 feet for a longer than 10-minute period. Our typical process has always included reviewing medical history to help identify risk factors, but this information is even more important at this time to review current medical issues, current medications, and really doing a thorough deep dive into their daily substance use. All of this information that we're gathering pre-admission, we're providing to our physicians so that alongside admissions, we can make the best decision on if somebody should be entering our campus. Families are asking a lot of questions about how to travel to campus. What's the safest way to do this? And we're really helping families to make the best decision for themselves and for their loved ones. And in the majority of cases, we're encouraging families to stay home and find alternative transportation, whether that's through our transportation, sober transports, or other car services, so that we know that we can get our clients here safely and we can follow the best practice and process that our doctors and nurses have put into place to help keep our patients and staff safe. After we've gathered all of these pieces of information, we're taking it to review with our physicians so that we can provide families and clients a clear understanding, a transparent expectation of what they can experience when they arrive here. Our physical admission process has also changed and has continued to evolve day to day through the process of how our clients are going to be met on arrival and what that process is going to look like, and to the point of what the family involvement is going to be if there's no other choice but to have family transport them to campus. We will have all of this information prepared so that the clients and families know before they get on the road to enter treatment. At this time, during the physical admission process, we are having minimal interaction with family. We're asking them to wait in the car, and our admission staff will go out to meet them to provide them with any necessary information they need or that they need to provide to us. On their drive home, our clinical team is reaching out to them just to do a general introduction and to gather any necessary information, and also to help them understand what their virtual involvement in treatment is going to be like. Their phone calls, their family education process that's going to happen virtually while they're here. For our clients, when they're entering campus, we have processed 2 different avenues. For clients that are coming from areas with a high rate of transmission, we're going to identify that prior to arriving to campus. That individual will receive a mask. They're going to be met by a nurse and have their temperature taken. And at that point, our doctors would have made the decision that we're going to put them directly into our medical unit in an isolation room so they can be alone while they're going through their level of care assessments with our doctors and physicians. If there are high risk factors with any of the symptoms that somebody has described, or if they are coming from an area with a high rate of transmission, we would provide them with having a COVID test on admission. And our turnaround time has been 24 to 48 hours, so we can put those fears and concerns aside and help them enter into treatment. If our clients are placed in our medical unit under an isolation protocol, they are meeting with clinicians, they're having virtual sessions, they're still engaged in the process. When we have someone that's entering treatment and is not coming from an area of high rate of transmission, we are greeting them at the door with a mask. They are meeting with a nurse to have symptom check and a temperature taken so that our admissions process can proceed as normal, spending as much time with them as we can. The length of time for someone to go through the admission process into the medical unit, depending on what their scenario is going to be, is rather short. So we're moving them along quickly through the process and helping them to understand the protocols and the process that we have put in place. So I'll now pass over to Ryan so he can run through similar scenarios and the process that we have put in place for Caron Renaissance and Caron Ocean Drive.
And do we have Ryan? Okay, we're going to wait on Ryan here for a moment. And I think, Megan, let's go into some of these questions. Oh, and there's Ryan. Thank you for joining us, Ryan. I'm going to go ahead and hand it off to you now.
Thanks, Sarah. Thanks, Megan. So I wanted to take a few minutes and update everyone on the practices that we're incorporating here in Florida as well for both Renaissance and Ocean Drive. And the questions and the screening process and a lot of what Megan already outlined are things that we're doing across the board. So we're also doing those here in Florida. The same screening questions with our patients and families over the phone are being done to identify any potential risk factors. And we also have some additional changes for the continuum in Florida. So for someone entering one of our programs here in Florida, they're going to go into, that patient's going to go into their own room for the first couple days that they're here. Similar to Pennsylvania, during our admissions process, we're getting vitals on our patients, we're taking those temperatures. And for our patients entering the continuum here, all of those patients are going to be wearing a mask for their first 7 days in treatment here. So our team is helping to prepare patients and families to understand that we're doing that just as a precaution for bringing someone new into the treatment milieu. Also, when we have patients who are transitioning from Pennsylvania to Florida, and we still have a fair amount of those admissions happening, we're providing the patients there with gloves and masks so that they can fly safely from our Pennsylvania location here to Florida. And upon arrival, those patients are still having use of a mask for their first 7 days. So I talked about the temperature being taken during the admissions process, but that's something that we're doing on an ongoing basis to monitor all the patients and staff here. So staff upon arrival to either one of our programs are having their temperature taken, and they're doing a brief screening assessment to see if there's any concerns about any flu-like symptoms or exposure to someone who there may be a concern about. And similarly for our patients, they're having their temperatures taken on a daily basis as well. And we have precautions in place that if someone were to have a temperature or any patient with a concern, we've set aside apartments and rooms at both of our locations so that those patients can be quarantined during that time of concern if we need to test them and monitor any symptoms. And similar to what Megan had shared, we're using iPads with those patients to provide telemedicine services, individual sessions, and even using Cisco WebEx to bring those patients into group each day. So the patients are still able to receive their programming. Another thing is along the same lines is that our staff, if there's any concern that they may have one of those risk factors, we're asking them to stay home for a period of time while a test can be conducted or they'll be monitored for any symptoms. So one of the differences for Florida is that the Florida governor had put a new mandate in place that anyone coming from the tri-state area would need to self-quarantine for 14 days upon coming to Florida. So what we've done is we are utilizing our Pennsylvania location for those patients where they can go there and quarantine for the first 14 days. And we can begin to work with those patients. They'll receive services through the Pennsylvania location, but we'll also be able to engage with them via video conference and WebEx as well. So that if those patients were intended for Caron, Renaissance, or Ocean Drive, that we can begin to offer some of those services virtually as well. And we have that capability with the Pennsylvania campus. So similarly, in our admissions process, which at times can be lengthier as we're engaging the patient and family about considering one of the Florida programs, historically, we've had a lot of patients and families come and meet with us on site when considering this. Something that we're now doing is doing those meetings virtually as well using WebEx. So you could have myself or another admissions person, someone from clinical leadership, even one of our physicians join in a meeting with the patient and the family to conduct an assessment, to answer questions about what the treatment here is like. And we're also working on having some families who wanted to experience what group is like or see what our milieu is, if appropriate, be able to join a group via WebEx as well. so they can get that exposure. And our families have offered very positive feedback about that. I think that largely covers some of the changes that we have for our Florida continuum.
Great, thank you, Ryan. And we're going to go ahead now and move on to questions that we received at registration when everybody signed up. Megan, I'm going to go ahead and start with you, and then I'd like to hear Ryan's answer to this question as well. And what is your call volume like right now? And what are you hearing on the calls that are coming in?
So our call volume has decreased. It does seem to be in response to just the messaging that's out there and individuals looking, at treatment. It has gone down a little bit, but the families that we've been working with, they've struggled with finding residential treatment if they cannot get into a hospital for detox because it's considered non-essential. Family members are seeking a lot of education about the disease of addiction, signs and symptoms, because they're starting to see behaviors while they're in isolation with their families that are alarming or scary. And they're really looking for suggestions on what the right next steps are. Ryan, did you have any additional feedback?
Yeah, definitely. To your point, Megan, call volume, we initially saw a decrease of about 20 to 30%. In the last week, it's been, we've seen a greater increase, but the calls that we're getting, we are seeing issues arise when the families are isolated together. And a lot of what I'm hearing from families is that the need that they're presenting with is really superseding the concerns about the COVID virus, is that some of the substance use or mental health concerns are so severe that the family is prepared to pursue treatment right now. They, of course, have concerns about how we're going to manage medical care here. And it's really important, like you mentioned before, to be transparent about our expectations for those families. We want them to feel comfortable in this decision. But ultimately, they're saying what's going on at home, they can't continue to be here. This is a danger for themselves. And even for our patients who are going through primary care or detox level of care first, they're saying, we're not ready to bring that person home. They need ongoing recovery support. And the fact that you guys can continue to provide long-term care in Florida has been a good option for folks.
Yes, and that's a great intro into another question that we received where people are asking, how can we get clients into long-term treatment or sober living communities? And I think that while this isn't directly admissions related, that we do have some answers for what we are doing and presenting on the front end. If Megan, you want to discuss that a little bit.
Sure. So we are working with families pre-admission, and then we are getting the question about what does long-term treatment going to look like? How am I going to get my loved one into the right next step? So we're working with families and giving them clear understanding of what is their discharge planning going to look like. We would have COVID-19 treatment plans specific for outreach, what alumni services look like, and helping them find an open facility for the next step. We're working with patients and families to extend in treatment, to go across the continuum because they feel safe and cared for with the physicians and the treatment team that we have here, providing them with masks and gloves before they leave to venture on to their next step. And they certainly know that we're here for them throughout any concerns after they're ready to discharge, as a place for support and ongoing questions during this time.
Yeah, and I can comment on that as well, which is just to remind and to let people know that we're still providing full care here in Florida. So both of our programs are providing full clinical services. That means several hours of group therapy each day, psychiatric care, individual sessions, 12-step meetings on the campus are done virtually with our alumni. We're still offering a full programming for folks.
Great, thank you both. And Ryan, this question is for you, and I believe that you already touched on it. The question is, how are we accommodating the state and federal guidelines for admissions in the Florida tri-state area? Are they being tested before they leave quarantine?
So we absolutely need to respect the guidelines that are in place, and we wouldn't want to circumvent those. But having that in place, having our patients be able to go to Caron, Pennsylvania as a first step, or one of our detox partners, allows them a chance to be quarantined for 14 days, also to administer a COVID test, to check temperatures, to make sure that those patients are safe before bringing them into our Florida continuum. And having a patient go to Pennsylvania, which is not a restricted area, for 14 days and start their treatment there with the NEAG Medical Center and everything that the Pennsylvania campus has to offer is a great way to meet that need. And then we have our patients who can have PPE, the personal protective equipment, to fly down to Florida, or in some cases have a sober escort pick them up and drive them down. So we can, there's been some families that will elect to do that as an alternative to flying, and we certainly have that capability too.
Great, thank you. And this question is for Megan. How do we know the family or prospective patients are being honest about their symptoms?
Yeah, that's an interesting question. I've been in admissions for 10 years, and I'm not sure that I've actually experienced a patient or a family lying in order to get into treatment. But with all seriousness, we are utilizing the same precautionary steps and measures that we are doing pre-admission, immediately upon admission, and consistently throughout their treatment stay. So at any onset of any symptoms, low-grade fever, we will rescreen and we will reassess with our medical team to make sure that our clients are in the safest possible area on campus for our current community and also for our patient, our staff as well. So we are going to continue to look at those symptoms and follow through with our physicians and nursing having oversight of that.
Thank you. And this is for both of you. How do your staff, how do you protect staff from new potentially contagious patients and patients from each other? I think we touched on this around the quarantine and the measures that we are taking upon admission. Is there anything else that you would like to add to that?
So we're operating really smoothly with having a large number of staff working remotely that can do their job at full capacity in that respect. And that's even through our admission process. So a good majority of our admissions call center staff aren't here on campus. We have the minimum amount of staff here that we absolutely need for patient-facing roles. Our patients are really the safest people on campus right now. Our staff, being around them, we know that they're in this quarantined environment here on the Pennsylvania campus. So we will utilize all the same precautions that we're asking our patients to, monitoring of washing of hands, the social distancing, wearing masks, and also just, really taking any questions or concerns to the physicians and nursing staff that we have available to us.
And we certainly appreciate people asking about our staff as well, and that's a concern too. Our staff here in Florida, admission staff, we are working remotely. All of our staff are available, and we're continuing that if anyone has any concerns about their physical health, to take that seriously, make sure that they're monitored. But fortunately, we're not on site, so that has reduced any contact with our departments. I think part of the question was also about, I think probably keeping patients safe too. And something I just wanted to add is that our patients here in Florida also have the option of wearing a mask. And we do have some that are available, and that's something that both the direct care staff, so here in Florida, our counselor assistant staff, our medical staff, the people that are having direct care with our patients within several feet are wearing masks currently. The patients have access to do the same. And in terms of the staff and patients being protected and staying safe, all of our group sizes have been reduced below 10 people. And additionally, we're putting at least 6 or 7 feet between each person in group, which if you've done group therapy before is quite a a different change when you're trying to foster intimacy and sharing in group. But our patients are very understanding of the change. And I think that our clinicians and direct care staff are very appreciative for the measures that we're all putting in place.
Thank you. And this is for both Megan and Ryan. How are you taking care of your admissions team during this crisis?
Yeah, that's a really important question for the admissions staff, specifically those that are at home managing the calls right now. It's always a high level of crisis and anxiety and stress when you're working with these clients. But when you're removed from an environment where you do have some indirect breaks that you can take or support that you can use with your coworkers, it's important that we're checking in on our admissions staff regularly, offering them additional group supervision and individual supervision so they can kind of talk through the process of the extra stress and fear around this process right now that they're taking on when going through these calls day to day. We use the term that they're, kind of just have this information stuck to them and no outlet. So we want to make sure we're providing them the opportunity to have supervision to be able to do that. And then our physical admissions staff reminding them of self-care during this process, taking some extra breaks, making sure that they're following the guidelines, the CDC guidelines of washing hands, using masks, hand sanitizer, whatever we have available to offer to them.
The answer is also that, Sarah, you set up yoga for all of us. So we're building in time into the schedule for additional self-care right now. It is really challenging. Our staff here have really been enthusiastic about still wanting to get patients into treatment. And we're meeting twice a day now as a way to increase all of the communication, because as things change, we want to be prepared to answer questions over the phone and also care for each other. As you guys mentioned, when these things are coming up, can really be stress and fear from the families that are discussed during these calls. So our team meets every morning and every afternoon via video to check in with each other, offer some peer supervision. And I'm meeting with the admissions staff individually here via WebEx for supervision ongoing. So I think those measures are helping to support our staff, and they seem really positive about continuing to do their jobs during this.
Thank you. And Ryan, this is for you. In what ways are your medical team using virtual technology to assist with admissions?
So we have our medical staff, when we've had a client who's coming in, historically we've used a telemedicine, which is a video conferencing system between our Pennsylvania location and some of our detox partners. And this crisis has actually forced us to increase the use of our technology. So we now have the use of WebEx, and we have the Pennsylvania location is set up to that we can interface with any of the staff there. We can assess the patients via video, and we can do the same thing with our detox partners here in Florida. And even if we have someone coming from home where it would be beneficial to get one of our physicians or clinical staff to be able to interview someone, like we're on camera right now, we can set up a WebEx meeting to accomplish that. So I think more out of necessity, we've expanded our ability to do video conferencing. And I think we're probably going to do that moving forward, even when some of this crisis subsides. So we're definitely able to see any patient or family via video conference prior to them coming for assessment purposes, and also so they feel comfortable getting to know us.
That's great. And I actually want to piggyback off of that for both of you for this, one of the live questions that had come in, which is, what are your suggestions for support for the family during and after treatment? For example, Al-Anon or anything else, some of the things you just described, Ryan, with regards to being able to have that contact via virtual with the families. What are some other suggestions for support for families during and after this time?
So I can start by answering that first. While our families are working with us, they're also working with a family therapist. At the Pennsylvania location, they're participating in FEP. They're doing sessions here with us in Florida. But we encourage the use of more support outside of that. And eventually treatment will end and they'll need a plan for ongoing recovery. So although, our partners, many of whom are on this video conference now, are not maybe physically in their offices, telehealth has been a great way for our families to get some additional support for themselves. So a family therapist, an individual therapist, online support groups. And we have a number of offerings through our regional offices that are now virtual as well. And one of the things that we do, particularly for our Renaissance program, is that we will connect a current family with someone who has had a loved one come through the program before as a family buddy. So that's a peer-to-peer support that they can speak with over the phone about any challenges that are coming up for them. So I think looking at it from all those different angles, we want to make sure that the family's getting what they need to.
Yeah, I think Ryan touched on everything. I don't have too much to add. We're working with families and providing them the necessary information they need, whether that's, viewing some of our doctors' videos so they can have a direct connection to the physicians that are treating and monitoring this process.
And I just want to add that our clinical leadership here has offered to speak with and has spoken with families with increased concerns around this. We've had patients that came into treatment prior to all this and no one was expecting this. And how do we change our treatment model to be able to, meet that need? So I'm really grateful for the leadership team here being available to all those families as well. And I don't know if I've mentioned this, but although we're not having families come on campus, and this is similar to what we're doing in Pennsylvania as well, we're doing video conference family workshop with them as well. And we're doing sessions. So our goal is to continue to provide those family services during treatment.
That's great, thank you. And what feedback are Caron patients giving about these virtual sessions that they are receiving should they be in quarantine?
So our patients that we've had so far that have been waiting on their testing or have been communicating with our team virtually, they feel very supportive. They feel very cared for. They know that the staff has their best interest at heart by doing this, but they have felt connected. Our families have appreciated the virtual sessions and still feel like they have a connection to campus and have a connection to the clinicians that their loved one is working with and are still getting the same high level of education and services that they need.
Yeah, and I think no one wants to be in quarantine or have any kind of restrictions. And I believe most people would prefer to be in person, but our patients have expressed gratitude as well for being able to stay connected, for all the staff that are continuing to check on them. And for our intensive outpatient, the patients who are off campus, those folks are still calling into their groups while they're not coming in person. We have still a really robust census of people in our intensive outpatient who want to stay connected through these mediums.
And this question is for Megan. Does Caron have as a condition of admission that prospective patients are tested?
We do not have that condition in place. We work through the screening process that we have so that we can make the best assessment of if there is a high level of risk or what the process would look like, but we're able to provide COVID-19 testing for our clients that are here on campus and have that really rapid turnaround time when someone is here.
And how are clothes and personal belongings being handled upon admission?
Here in Pennsylvania, our clients are keeping their personal belongings, their clothing within their room of isolation. At the point that somebody is out of isolation, it's still continued to follow them through to kind of their next location here on campus. In the event that somebody were to continue to have symptoms or there would be any risk of transmission of infection, we would then assist them with washing and disinfecting any of their belongings.
And this would be for both of you. We can start with Megan. Do you do anything differently with clients who are incarcerated and seeking admission during this time?
So in the situations that we've been recently, the assessment screening tool that we have in place has worked to be able to assess individuals that are incarcerated, to be able to have a seamless process of transitioning out of incarceration into treatment, still having the same process in place of assessing them as soon as they walk in the door for any changes of any symptoms.
And here in Florida, we're doing the same thing. We're still working with patients who are incarcerated coming into care. It may mean an extra step as a precaution. It may mean going to Caron in Pennsylvania first, maybe one of our detox partners as a way to get some additional assessment of that patient. But we're still working with people that are incarcerated.
Great, thank you. And I'm going to go to, I've been sprinkling in some of the live questions. This is time for people to ask any questions, and we'll see if we get time to get to all of them. One of the questions is, are you seeing an increase in admission requests for populations that are typically hesitant to seek residential treatment, like teens, young adults whose parents who have historically don't want to pull them out of school, or from executives who are anxious about not being in the office?
Yeah, here in Pennsylvania, we've certainly seen an increase in the teen and young adult population. Families are now, they're spending more time, they're coming home from school, and these families that we're working with are willing to hold boundaries easier than they were before, allowing the school process to still happen on our campus. Our older adult population feel comfortable with the medical pieces that we have in place to be able to screen and assess clients. So those two are specific areas that we've seen uptick in inquiries for Pennsylvania.
I know you said both of us, but I don't have much to add in this way in terms of any notable, populations who are seeking care in any different way. That was all.
Okay, great. And I believe that, oh, here we go. For new admissions, has there been any thought about isolating these individuals for a short monitoring period in their first few days?
In Pennsylvania, we are isolating patients when they come in if they meet any of the areas of risk factors, if they're coming from a high rate of transmission area. We will put someone on isolation protocol if they experience or have any symptoms upon arrival. Right now, our best practice is to supply a mask for the initial first 7 days of treatment as they come in, if they're not coming from one of the areas that the doctors have identified that isolation is necessary.
And my answer is pretty much the same. Our patients are not isolated when they're coming in. If they're coming from areas of any higher transmission, they're going to go to our Pennsylvania location first. And we're having all patients come in, wear a mask for their first 7 days. And they do have their own bedroom and bathroom during those first couple days of treatment here as we monitor any symptoms. So we found that to be an effective method thus far.
And how do you see this pandemic affecting people seeking substance abuse treatment once this is all kind of subsided?
So we're working with a lot of families that aren't quite ready to identify either that themselves or that their loved one have signs or symptoms that they need an inpatient treatment. So I do believe that we'll start to see some more inquiries after some of this, and people are more comfortable with traveling, more comfortable with knowing that they'll be able to return home after any treatment stay. We will likely be helping and assisting families work through questions about insurance and COBRA and, financial questions and concerns that people are going to have after this. So we'll be working with them to educate them about the process, what resources they have available in order to get into the right level of treatment.
I think we're definitely going to see a surge when travel becomes less restricted and people feel more comfortable to travel again. I know that we have several people for our Florida continuum who have already committed to coming and participating once they feel comfortable that some of the concerns right now are lifted. So I think we're definitely going to see a big increase.
And Ryan, I know Renaissance has a digital use disorder program. Do you expect to see an increase in inquiries specifically for this program?
I hadn't thought about that prior to this point. I think that's a great point, though. With people social distancing and being at home, and the amount of screen time that's going on right now, and parents doing their best to keep a lid on things at home, I do think we're going to see, and that typically comes more from our teen and young adult population. I do think we're going to see higher instances of people seeking treatment for digital addiction.
And Megan and Ryan, I think this is both for you, but how willing or resistant have Florida patients been with beginning their treatment in Pennsylvania?
Patients and families have been very understanding. I think everyone knows what's going on, understands the concerns, and wants to take extra precaution to be safe. And that's what we're doing. We still recognize that people need substance use treatment, but that this is an additional step, particularly if they're coming from a high transmission area. So, I haven't encountered any families who weren't willing to try and seek a solution using our Pennsylvania location.
Yeah, I agree with Ryan. I think during this time, we've seen a higher rate of compliance with what our physicians and our treatment team are recommending, given just, the clients that we have that are willing to stay or willing to extend in a residential setting during this time.
And do you have a co-occurring substance use disorder in order to admit? Do you have to have a substance use disorder in order to admit somebody into the digital use disorder program at Renaissance?
We do not. No, we treat patients at our Florida continuum that don't have any substance use disorder. So we have patients who come to us who are here primary for digital addiction and other process addictions, sex addiction, gambling, spending, stealing, shopping, issues around failure to launch, anything along the obsessive compulsive spectrum. We're willing to take a look at as a possible admission.
Okay. And I believe that is all the questions that we have for today. We really appreciate Ryan and Megan, you guys joining us, sharing your expertise in this area, and really just being leaders during this time for families and patients and referrents that are dealing with this pandemic. So I'd like to thank everybody for joining us today. We encourage you to be in touch with your local regional resource director. And should you have any additional questions at all, please don't be afraid to reach out. Join us next Tuesday at 11 a.m. for the next webinar in our series, Mindful Management of Stress and Anxiety for Patient and Providers. Registration is open for this webinar. Watch for more information in your email, and thank you so much for attending, and take care.